Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about oral manifestations and management in Down syndrome. Let's start. So today's episode is all about the dental considerations and oral manifestations of Down syndrome in children and patients. And this important episode has been created for, I think it's my social responsibility to make everyone, aware, especially parents who have children who are suffering from Down syndrome, as well as clinicians who might just not know or understand what all they need to do when it comes to treating, children with Down syndrome in their practice. So Down syndrome is a genetic disorder which is seen in at least 800 to 1000 live births, which is characterized by Mongolian features, which is also known as Mongolism, which is a genetic disorder caused by the trisomy of the 21st chromosome. I'm not going to get into the genetic details about it, and it can have different variations and different severity of the cases, where the kid might just be almost within the normal limits of physiology and cognitive development, to the fact they might be non-verbal. Now that is something for the the physicians to see, and basically it is a genetic disorder that retards the the cerebral growth, the cognitive function and the physical function of the child, which also has some medical implications such as heart defects such as mitral valve prolapse or ventricular septal defects or other heart defects. And the children are supposedly more prone to diabetes, epilepsy, hypothyroidism, leukemia and all these conditions. So when it comes to the basics of Down syndrome, it's known as Mongolism, where you can see that the stature of the individual is short. They have a webbed neck. Their outer canthus of the eye is slightly higher than the inner canthus, and it has a epicanthic fold which gives a Mongolian appearance. They have an oval rounded face, with the mid face not being growing with that much of nourishment, and it is more deficient, which gives a typical almost like a class 3 angles malocclusion. That means the lower jaw is it feels that it is coming out. There is more prognathism. They have cracked and fissured lips and the fissured tongue, and the tongue, because of the hypotonicity, that means the tongue muscles are they're not that strong. The tongue seems to be drooping out. They might have hypersalivations or drooling of the salivation from the corner of the mouth, and also they can have other abnormalities such as the palmar crease and all those things. Now when it comes to the oral manifestations, you have to understand that a typical Down syndrome can be identified with the features that have been explained earlier in this video. When it comes to their jaws, the mid face is actually very deficient in growth, and that's why they have a relatively prognathic mandible. They have a smaller maxilla, that is the upper jaw, and that is why the tongue, which is usually of the normal size, seems to be bigger. And because of the hypotonicity, that means the lack of control of the tongue muscles, it seems to be coming out or jutting out of the mouth. That's why a lot of people think that they have bigger tongues or macroglossia. Now when it comes to other things, they have some propensity towards heart defects that I've already told. They also have some defects when it comes to their host responses, which predisposes them to chronic upper respiratory tract infections and other infections as well. When it comes to their oral health, their teeth are much smaller. Sometimes there is the teeth exhibit taurodontism, and a lot of times there is delayed eruption of teeth. Now there is delayed eruption of teeth, that's why they might be more spacing the teeth, that's why they give that appearance. On top of that, you have to understand that they have very high propensity towards periodontal disease, because of the fact that their salivary flow rate is smaller, and because of the fact that there is a deficiency of how their immune responses work. They have impaired phagocytosis, they have impaired T cell mediated immunity. However, on the contradictory side, or in contrast to periodontal disease, they have lower caries risk rate, because of the fact that the teeth don't even erupt at the time because of delayed eruption. So in a normal child, by 6 years of age, the first permanent molar erupts. This kind of erupts by 8 to 9 years of age, and basically that's why the caries risk rate is much lower in there. The salivary pH might be higher or lower depending upon the studies. They do have a propensity towards periodontal infection, bone loss, early loss of teeth, posterior cross bites and all those other things. Now, when it comes to considerations of a Down syndrome patient, this goes for the parents as well as any clinicians watching. It is always better to get a pediatric consultant on board when it comes to dealing with the Down syndrome patient, especially because they are mostly of younger age, and they have the pediatric consultants know when it comes to how to treat children with special ability and healthcare needs. Secondly, it is better for you as a clinician to have a talk with the parents before the child even steps into the clinic, because of the fact that it has to be understood to what level is the Down syndrome or the cognitive development hampered in the child. If the child is verbal or non-verbal, how much is the language or the communication barrier, how anxious the child usually is to newer surroundings. Those things matter a lot. Secondly, you have to get a physical workup done, a blood checkup done, especially a complete physical done by the physician of the child, so that you know what is their cardiac status, what kind of subacute endocarditis prophylaxis they might need because of any particular heart defects which might be present and that might require some prophylaxis. After that, all those things said and done, you need to start getting the child on board. The first sitting is not about the dental chair and placing the child into the dental chair. It is more of interacting with the child, getting them acclimatized to the dental environment, making it more friendly, understanding what kind of level of communication or language barrier that might be present. And you have to understand that there might be a lot of malocclusions, anterior open bites, tongue thrustings, all those things. So you might want to get a multidisciplinary team involved in the treatment of the child, depending upon what all problems the dental care needs the child has. And finally, you have to be very patient with the child. You have to make sure that everything is taken slowly, all the informed consents are taken, complete cardiac and physical and medical workup has to be done. And finally, if you are a parent who is watching this episode, you are already going through a lot taking care of a child with special healthcare needs. So first of all, salute to you for that. And secondly, what you need to understand is, if at all you have any problems or any sort of queries when it comes to doubts or apprehensions when it comes to the oral health of your child, it is always better to call up a dentist, especially a pediatric dentist who has these provisions in their clinical facility, or visiting consultants who know how to take care of children with special healthcare needs, where you can probably have a meeting with them, set an expectation setting, and think and start deciding about what the treatment needs to be. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's giving you discomfort. Then we can have a talk. I might not be able to reply promptly. I might reply in a couple of days. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.